Good holy everyone, my name is Ella Milotero and I am from BS Ed Filipino 4. Today I am going to discuss one of the learner's chronic illnesses. But before that, we're gonna have a quick exercise kaugnay sa topic na aking i-discuss for today. This activity is called the word scramble kung saan i-arrange nyo yung mga letters para mabuo yung words o yung terms based doon sa binigay na definition. And you will only be given 10 seconds to answer each item. Mangyaring ilagay lamang ang inyong mga sagot sa ating chat box. Okay, let us start with the number 1. This is called the doctor for the skin. What word is it? Your timer starts now. Next is number 2. A damaging immune response by the body to a substance, especially pollen, fur, a particular food or dust to which it has become hypertensive. Ano ito? Number 3. A substance that can cause allergic reaction. What is it? Next is, it is a condition that causes your skin to become dry, red, itchy, and bumpy. It is one of many types of dermatitis. What is it? Finally, we have here the number 5. It is a physician specializing in the diagnosis and treatment of allergies. What word is it? So that's it. That's the conclusion of our quick exercise. Let us now reveal the answers. First, we have here the number 1, the dermatologist. Our number 2 answer is the allergies. Number 3, allergens. Number 4, the eczema. And the number 5 is the allergist. Thank you so much for your response and participation. So based doon sa ginawa nating activity, kani-kanina lamang, may idea na ba kayo kung ano yung magiging topic natin for today? Magaling. So now, let us proceed to our formal discussion. And here it is. My topic for today is all about the learner's chronic illnesses, particularly the allergies. So first, let us know what is an allergy and what are the different types of common allergic conditions. When we say allergies, these are the body's overreaction to substances that in non-allergic people are harmless. These substances called allergen can enter the body through the skin, eyes, nose, mouth, or digestive system. So some common allergens include dust, molds, pollens, mga kagat ng insekto, animals including their dander, hair, fur, feathers, and saliva. We also have here the chemical vapors from paint, perfumes, food, and smoke. So basically, our immune system naturally produces substances known as antibodies. But when you have allergies, your immune system is quite different from the normal one because it makes antibodies that identify a particular allergens as harmful, even though it is not. The antibodies then travel to cells that release the chemical histamine when triggered, which causes an allergic reaction. So when you come into contact with the allergens, your immune system's reaction can inflame your skin, sinuses, airways, or the digestive system. On the other hand, these allergy symptoms may be mild, moderate, or severe, but even if it is mild symptoms, if it is chronic, it can cause students or a person to be absent from or have difficulties in school or to do other activities. However, allergies can be controlled naman and symptoms can also be managed. The severity of allergies varies from person to person and can range from minor irritation to anaphylaxis, a potentially life-threatening emergency. Pag sinabi nating anaphylaxis, it is a severe allergic reaction that causes rapid life-threatening effects throughout the body and typically requires immediate medical attention. So, itong anaphylaxis na tinatawag sa madaling sabi, ito yung pinakagrabing point na pwedeng maranasan ng taong may allergic reaction. During anaphylaxis also, a person may experience constriction of the airways and swelling of the throat. Blood vessels may also be expanded or which can cause a severe drop in blood pressure. Kaya it is important to know your jurisdiction's protocol in relation to this serious medical condition. So dapat, if you happen to have these allergies or meron kang kasama sa pamilya, especially children, dapat alam mo yung mga bagay na dapat mong gawin kapag umabot sa punto na nagiging delikado na yung symptoms. Kasi if hindi ito kaagad na agapan, maaari mo itong ikamatay or ng taong nagkaroon ng allergic attack. So we have here the signs and symptoms of anaphylaxis. We have difficulty in breathing, such as fast or shallow breath, wheezing, rapid heartbeat, anxiety or confusion, low blood pressure, feeling lightheaded or faint, and losing consciousness. So we have to be aware sa mga signs na to so that we can immediately call an emergency. Now let us go to the question, how do the allergies develop? So allergies can develop at any point in a person's life. Usually allergies first appear early in life and become a lifelong issue. However, allergies can start unexpectedly as an adult. But a family history of allergies puts you at a higher risk of developing allergies sometime in your life, since the tendency to develop allergies is often hereditary, which means it can be passed down through genes from parents to their kids. But just because your partner, or one of your children might have allergies doesn't mean that all of your kids will definitely get them. And one of the factors din ng pagka-develop ng allergies is the change of the environment or the sudden change of environment, where our body nag-a-adjust doon sa bagong environment na pinaglipatan natin, kaya nagkakaroon ng reaction yung ating immune system. So now let us move on to the different kinds or different types of allergic conditions. We have here the allergic skin conditions, and there are different types of allergic skin conditions. First is the eczema, or it also called as atopic dermatitis. It is a long-lasting skin condition in which the skin is overly sensitive to many things. It can affect older children, most often in the inside of the elbows, back of the knees, wrists, and neck. And in young children, it may just cause dry, rough patches of skin, particularly in the face and trunk. And then, we also have the hives, or also called as urticaria. These are the patches of itchy, swollen skin that move to various parts of the body. They can be small and look like insect bites, or the patches can blend together to form bigger areas. Hives are always very itchy and sometimes made worse by the pressure, heat, or distress. So itong hives do not scar or leave marks. However, scratching the hives can lead to a secondary infection which may require further treatments. So para lang siyang yung sinabi dito, para lang siyang kagat ng insect but kumakalat siya eventually kapag nalalamigan or naiinitan. But hindi siya nagsusugat unless kinakamot siya ng kinakamot hanggang sa masusugatan na. Next is the contact dermatitis. It is caused by a reaction to something touching the skin. Two common examples are poison ivy and a rash around the belly button in people who are allergic to nickel, which is often found in fasteners on waistbands of pants. It may also occur in the diaper area if the baby is allergic to the scent or dye used in the diaper. Unfortunately, none of these conditions are contagious. Kaya wala dapat ikabahala o hindi dapat pandirihan kasi hindi naman ito nakahahawa. Here are some pictures of how the skin conditions look like. As you can see, ito yung larawan ng eczema. Then, itong hives, yan yung itsura ng hives. And the contact dermatitis. You can see the difference, no? So the question is, how common are they? There are estimated 20% of infants and young children may be affected by the eczema at some point. But there is no good data about how frequently hives and contact dermatitis occur. And now, nandito na tayo sa common allergic conditions in children. We have here the allergic rhinitis, or also called as hay fever. Allergic rhinitis is the most common childhood ailment caused by allergies. Symptoms include a runny and itchy nose, sneezing, postnasal drip, and nasal congestion, or the blockage. A child with allergies may also have itchy, watery, red eyes, and chronic ear problems. Even though it is commonly known as hay fever, allergic rhinitis isn't triggered by hay and doesn't cause fever. So next is we have this allergic asthma. It is a breathing condition where the airways you breathe through the tightened when you inhale an allergen. Common allergens include pollen, dunder, and mold spores. This type of asthma is very common in both children and adults. Symptoms of allergic asthma can include shortness of breath, coughing, wheezing, stuffy nose, and itchy eyes and rashes. So, kadalasan yung common allergens ng asthma ay yung mga nasisingot like alikabok, yung mga pollens and so on. We also have here food allergies. So the most common allergies in children are to peanuts and milk. Other frequently seen triggers include eggs, fish, shellfish like crabs, lobster, crayfish, and shrimp. The most severe reactions are typically to peanuts, tree nuts, fish, and shellfish. All allergies that can last a lifetime. So how to reduce the symptoms of this common allergic condition? So people with allergies experience many nasal passages, lung and skin symptoms. Treatments for allergy symptoms include the antihistamines. You also have here the nasal corticosteroids, the decongestants, the mast cell stabilizers, and the oral corticosteroids. So this can be taken orally or ini-inject siya. So depende na yon sa severity ng inyong condition and kung anong condition meron ka, and based na rin doon sa prescription ng doktor mo. And ngayon naman, ating pag-uusapan ang allergies and school. And what are the implications for planning, awareness, instructions, social, and emotional being? Your child's school should be informed or any allergies. If your child has asthma or a severe allergy, give a copy of your child's action plan to the school nurse or the administrative office. So we have here the asthma and the physical education. So physical education and sports are a big part of the school day for many children. Having the asthma does not mean eliminating these activities. So children with asthma and other allergic diseases should be able to participate in any sport that the child chooses, provided that the doctor's advice is followed. Asthma symptoms during exercises may indicate poor control, so be sure that your child is taking control or asthma medications on a regular basis. So despite of having these illnesses, kailangan pa rin na i-include yung children in different physical activities with of course given na mayroong necessary precautions, guidance ng teacher and all other things na kailangan para makapag-participate yung bata. These kind of activities din kasi would also help the learners in developing their self-esteem, their skills, their physical and social growth, and so on. In doing so, we could avoid learners being left out from the class or from the other children. And we also have this dust irritation. At school, children with allergic problems may need to sit away from the blackboard or in order to avoid irritation from chalk dust. So, understandable naman na kailangan talagang ilayo yung children sa part ng classroom na pwede siyang maka-accumulate ng alikabok such as yung malapit sa blackboard. And as much as possible, linisan talaga ng mabuti yung classroom para maiwasan ito. Since it is impossible for parents to control absolutely everything that their child is exposed to or eats, parents should instead focus on monitoring their child for symptoms. And also, early identification of childhood allergies will improve the child's quality of life, reduce the number of missed school days. That's why we have here the implications for planning and awareness. Meet with the student and the parents early in the school year to discuss how the school can support the student's needs related to allergies. The family and the school also need to be clear about what can and cannot be done so that everyone's expectations are achievable and realistic. This could include finding out about the student's strengths, interests, and areas of need, the student's specific symptoms, the common triggers that need to be considered at school, and the successful strategies used at home or in the community that also be used at school. In collaboration also with the parents and the healthcare care professionals, develop a written management plan that aligns with related jurisdictional policies and protocols and could include the specific information such as the role of the school staff and when and what emergency measures should be taken. If the student is taking medication during the school day, discuss with the parents possible side effects. Follow school and or jurisdictional policies and protocols in storing and administering medication. We also have to work with the parents to carry out a risk assessment to determine potential hazards and to plan for the student's safe and successful participation. Next is collaborate with the parents and students to consider if and how they would like to share specific information about the allergies with peers. If they wish to do this, consultation with the healthcare providers such as school or community health nurses may be helpful. Also, learn as much as you can about the allergies may affect learning and social and emotional well-being. Reading, asking questions, and talking to qualified professionals will also build your understanding and help you to make decisions to support the students' successful school. And lastly, we have to develop a system for sharing information with relevant staff members about the students' allergies and successful strategies. So as a teacher or as a school staff, your awareness needs to begin with conversations with the student and the student's parents. Now let us go to the implications for instruction. Be aware that the students with severe allergies may have numerous absences due to medical appointments or treatments or fatigue. Develop a communication strategy between the home and the school to stay informed about the absences and to keep the student and family connected to classroom learning. Also recognize a student who has been ill with allergies or has recently had an allergic episode may need some time to work up to speed again or adjust the workload if needed and provide an appropriate academic and social support. We also have these implications for social and emotional being. Support the development of the self-advocacy skills such as the teaching the students to ask for what they need. So when possible, involve the students in monitoring the success of supports and strategies used in the classroom. Another thing is, if required, make necessary adjustments to social activities to allow students with allergies to participate safely. Listen to students. So respond quickly if a student identifies the beginnings of allergic reactions. And we have to recognize that the students may have dietary restrictions. So help the students feel included in the classroom by considering this when foods are served for special events or brought into the classroom. And now let us tackle about the questions you may ask or some questions you may ask about this topic. So first, can allergies be cured? So there is no currently cure for allergies. However, the researchers continue to investigate and find potential therapies para mawala itong allergies. But people can treat their allergy symptoms with medication and can take steps to reduce their exposure to the allergen causing the reaction. So yung allergies po mismo ay walang gamot, pero yung allergic symptoms or reactions ay pwedeng matreat gaya nga ng mga nabanggit kong medications kanina. So the next question is, what are the treatments for allergic reaction? Aside doon sa mga nabanggit ko na kanina na mga medications, we also have this immunotherapy, which is not a cure for allergies, but it is a disease-modifying treatment. It may help to reduce a person's sensitivity or allergic response to allergens. So a doctor may recommend immunotherapy if medications are not controlling allergy symptoms. A person is unable to avoid allergens kapag hindi talaga naiiwasan na magkaroon ng contacts sa mga allergens. And then, allergy medicines are interacting with a person's other medication. At kapag nagkakaroon din ng allergic reactions sa mga gamot, yung taong may mga allergies. So, next is, a patient does not like taking medications. So, yun yung pwedeng makontribute ng immunotherapy sa taong may allergy. We also have here the allergy shots where which involve having exposure to increasing doses of an allergen by injection over the several years. Over this time, a person becomes less sensitive to the allergen and reacts to it less severely. So, allergy shots help control the symptoms of allergies to pollen, to dust mites, to pet dangers, and so on. And lastly, do allergies go away? Well, as what I have said, allergies can't be cured, but symptoms can be controlled using a combination of avoidance measures and medications, as well as an allergen immunotherapy in properly selected cases. But some people may outgrow allergies, especially allergies developed during early childhood. Whether someone's allergy will disappear as they get older depends on what they are allergic to and the severity of their allergy. Experts suggest that with exposure to small amounts of an allergen over the time, a person may develop tolerance. This is similar to the way vaccines or the allergy shots work. And lastly, consult a doctor. A person should consult a doctor or an allergist if they experience persistent allergy symptoms that do not ease with treatments or that interfere with carrying out their daily tasks. An allergist is a doctor that specializes in treating the allergies. And also, for those who have skin allergy conditions, they could also reach for dermatologists and who are doctors for the skin. It is also very important to consult a doctor so that para magkaroon ng proper diagnosis and proper medications. Kasi hindi ibig sabihin na nakitaan ka ng allergic symptoms ay pwede ka nang mag-self-diagnose na allergy ngayon kasi hindi rin pwedeng uminom ka ng gamot para sa allergies without making sure na meron ka nga talagang allergies. Kasi there will be possibility na baka iba pala yung sakit mo tapos iba rin yung gamot na ininom mo which can probably cause to a more problematic situation. So, I think that is the conclusion of my report. I hope you have learned something and that would be all. Thank you.